Good morning, good afternoon, or good evening, depending on where you're joining us from. And we are coming through to you from the African Union headquarters in Addis Ababa in Ethiopia, bringing you the usual Thursday morning Africa CDC media briefing on the state of the coronavirus on our continent of Africa. My name is Wayne Musabayana, and we are joined by Dr. John Nkengasong, who is the director of the Africa Centers for Disease Control and Prevention, the Africa CDC. Of course, he's going to be giving us the full details on the situation of COVID-19, as we've stated, and also perhaps delve into the issues of the new variant that is really topical and that has been topical over the past week. So when we do come to the question and answer section, we do have that usual WhatsApp number. Please make sure you utilize it. But you can also come through live on this platform, as well as use the question and answer section. Well, for now, it's time for me to hand over to Dr. John Nkengasong, the director of the Africa CDC. Dr. John, it's over to you.
Thank you. Thank you so much, Wayne. And greetings, colleagues, and the media, everyone who has joined and usually joins every Thursday. And apology for the slight delay. We were having a little bit of challenges this morning connecting. So let me, as always, do the following, give you an update on the epidemiological situation of the COVID-19 on the continent, and then discuss the vaccination and vaccine situation. And I'm sure that we are going to be having a very engaging conversation on the variant, the Omicron. So first of all, let's start with the epidemiological situation, where as of today, December 2nd, a cumulative total of 8.6 million people have been reportedly infected with COVID-19 on the continent. Of that number, unfortunately, 223,000 people have died across the continent. And over the last couple of weeks, the 5 most populous countries in Africa that account for at least 61% of all caseloads include South Africa with 34%, Morocco 11%, Tunisia 8%, Libya 4%, and Ethiopia 4%. When you look at the numbers of countries that are going through the third wave, the fourth and fifth wave, the numbers have not changed significantly. We still have 46 countries that have gone through the third wave. 11 countries, as I stated last week, are currently going through the fourth wave. But importantly, Mauritius is now going through the fifth wave. So that is the only change from last week. However, it is important to notice that the situation with the variant is changing very quickly. 45 countries have reported the Alpha variant. 41 countries have reported the Beta variant. 44 countries have reported the Delta variant, with Djibouti now reporting that variant, which is the newest addition to the list of countries. 2 member states are reporting the Gamma variant, and 4 countries are now in Africa are now reporting the Omicron variant. And we all know this variant was initially picked up by the good surveillance systems that the government of South Africa and the scientists have put in place. And the countries include South Africa, Botswana, Nigeria, and Ghana. And on this note, I really want to join others in recognizing and congratulating South Africa, the leadership for being very transparent and timely so, and the scientists for the extraordinary work that they've done in picking up this variant. And not just this variant, but we also recall that the Beta variant was initially picked up due to the extensive state-of-the-art surveillance work that goes on in South Africa in terms of pathogen genomics. When we look at the trends, if you compare last week and this week, we observed a total number of 52,300 new cases. 52,300 new cases, and that represents a 105% increase in the number of new cases compared to last week. And we'll explain why this rapid increase there. If you look at our curves, we have been going down very nicely. That is bending the daily, 7 days daily moving average very nicely, but there's a little bit of ticking up in South Africa, and mainly attributed to this variant, and that is why you see this sharp increase there. So if you now look at different countries with reporting the highest number of new cases, we have South Africa with 31,000 cases. Remember, out of the 52,000 new cases, 31,000 are coming from South Africa, Egypt with 6,000, Libya 3,800, Mauritius 1,200, and Algeria 1,200. So that explains that 105% increase there that I just mentioned in terms of new cases. So it's skewed towards the situation in South Africa, which is driven now beginning to be driven mainly by the Omicron variant. So if we now look at the new deaths, as of last week to today, a total of 938 new deaths have occurred. And that represents 8% average decrease in the number of new deaths. If we now look at the last 4 weeks, then that is specifically the period between the 1st and the 28th of November, we notice a 20% average increase. Remember that ticking up is contributing to this, now contributing to this increase, where we have enjoyed a downward trend all the time. And the distribution looks as follows: a 153% increase in Southern Africa, 34% decrease in Central Africa, 19% average decrease in Western Africa, 7% average decrease in East Africa, and 1% average decrease in Northern Africa. If you look at the following breakdown by the most populous countries, we have South Africa with 196% average increase, DR Congo with 45% average increase, Ethiopia with 25%, 22% average decrease, Nigeria 19% average decrease, Kenya 14% average decrease, and Egypt 0.3% average decrease. In terms of new deaths over the last 4 weeks, we observed a 9% average decrease over that same time period. Our testing situation continues to be stable with a cumulative number of 82 million tests conducted since the start of this pandemic. Just last week alone, about 1 million new tests were conducted, and that represents a 26% average increase. In terms of vaccines and vaccinations, a total of, as of today, a total of 417.5 million COVID-19 doses have been procured by 54 member states in Africa. And of that number, a total of 235.8 million doses have been administered. The total coverage, that is the number of people that have been fully vaccinated, has edged up slightly to 7% on the population, with Morocco leading the charge with a total of over 60% vaccinated, Egypt 14% fully vaccinated, South Africa 34%, Algeria 11%, Mozambique 8.9%. Now, this is the percentage of population fully vaccinated. If you stratify this by the eligible population, that is the adult population vaccinated, some of these numbers are significantly higher. Like South Africa will probably be around 35% to 40% of the eligible population vaccinated. Harvard, the African Vaccine Acquisition Task Team, has distributed a total of 22.4 million doses of vaccines as of last week. Just last week alone, that is from the 25th of November to the 1st of December, 3.2 million doses of the J&J vaccines were distributed to 7 African member states, and they include Mozambique, Burkina Faso, Rwanda, Egypt, Gabon, Congo Republic, and Ethiopia. Now, the good news this week is that we all read the big story that the Aspen group in South Africa will be having a license to produce the Johnson & Johnson vaccines locally. That will be a license production, not contraction, which was remarkable news that we need to celebrate. We are beginning to see good progress in terms of manufacturing of vaccines on the continent. We need to celebrate that. Let me just end by saying that on Monday and Tuesday of next week, we will be hosting a meeting, a very important meeting in Kigali, where we will be at the head of state level, where we will be discussing pathways for the continent to issue emergency use authorization for vaccines as they come online. I just talked about South Africa. We hope that in the coming months, you get other countries like Rwanda, Senegal, and others begin to produce vaccines, and that will require that the continent develops a mechanism for approving the vaccines through the AMA, the African Medicine Agency. Thank you so much for your attention, and I look forward to your questions.
Thank you very much. That was Dr. John Nkengasong, the Africa CDC Director. We now move straight into your questions, and I can see that there are a few hands that have gone up. So let us start by saying good morning to Gabrielle Steinhauser, who is with the Wall Street Journal. Gabrielle, please, good morning, and go ahead.
Good morning. Thank you so much. How concerned are you about the COVID situation in Southern Africa and South Africa specifically, given that, at least in South Africa, we've seen this huge jump of cases with the new variant just over the last week or so? Is the Africa CDC doing anything to help countries prepare as their public health systems might come under pressure? And are you concerned that the travel bans will lead to shortages of some of the equipments and other, other things that countries need to deal with this huge surge in cases? Thank you.
No, thank you. We are definitely very concerned with the situation in Southern Africa and South Africa in particular. You saw the numbers that I just discussed with you. But we are not worried that the situation cannot be managed. Remember, this will be the fourth wave that we are going through the continent. So we've become at least more prepared to deal with this wave that come in and go. I mean, remember, this was the situation just in August, where we are dealing with a very brutal and aggressive third wave. So we know how to deploy rapid responders. We know how to deploy commodities. We know how to provide the interventions that are necessary. But we have been preparing for this for the longest, which is, remember, our message has been that as we were at the trough of this pandemic, which is the lower end of the transmission, what I call the low transmission season, that was the period to increase vaccination. And we have been saying this for the longest, that I was absolutely clear that just the other week or the few weeks ago that we will be facing another wave. What is worrying, however, is that we are moving towards the end of the year holiday seasons. And my concern and worry is that as people move around more, there's a greater risk that there will be, these infections will continue to increase. And we expect to see really an outburst towards the end of December and January time period because of the holiday seasons there. So I think Africa CDC knows what to do. We've been dealing with this during the third wave, which was very, very aggressive. In multiple countries, we deployed swab teams across supply materials and to many, many countries. And we were preparing for this just as we did for the last wave. And I don't recall the last, your last question, what was it again, about the supplies. I believe that hopefully, as we know more about this variant, that the bans on the flights to Southern African countries will be lifted. And as the variant spreads across the world, I think there are about 23 countries now that have reported this variant. I also interpret the bans that they were just early measures taken to blunt the spread of the variant. It's very difficult to stop these variants from spreading once they're out there. But it is my hope and wish that these bans should be lifted quickly so that South Africa will continue to get the supplies that they need.
All right, thank you very much, John. Let's move on now to Paul Adepoju. Hello, Paul, please go ahead with your question.
Yeah, thank you very much. So, Dr. John, I have 3 questions for you. The first question has to do with the Omicron variant itself. And when you look at the conversations around travel restrictions not working, the response from experts that I've been talking to regarding this is that travel restrictions actually allows countries to better prepare and slow down the spread of the variant among their populations. And we've also been seeing some African countries giving suggestions that this could actually happen. So I would like a comment on that. In addition to that, we are also seeing conversations around some African countries putting the blame on richer countries not releasing doses. But we also see cases where millions of doses have been made available to some African countries, but these have not been quickly rolled out as quickly as this would be. So I would like your response on that. If anything can change to quickly accelerate the rollout of available doses for Africa. And the last question, which is really, really important, is the situation in Nigeria. Prior to the Omicron, previous variants in Nigeria were reported by the Professor Happy-led laboratory. But we now see the NCDC now actually be the one also carrying out sequencing. So I'd like to know if this is part of the structuring, how effective you think a regulator doing the sequencing on its own instead of maximizing the available networks of sequencing capabilities that the country currently has. Thank you very much.
Thank you, Paul. The Omicron variant, as you rightly said, when countries react to, so let me step back and say this, that we knew, and everybody knows, that travel restrictions have never stopped these variants from spreading, for sure. We also know that that countries react in a way that is never been coordinated in this pandemic. There's nothing that in this pandemic has ever been coordinated across the world. I mean, Africa has done well to have a coordinated joint strategy, but you can see that when people see these variants emerging, there's total individual countries react differently. And our recommendation and that of WHO is aligned, that restrictions do not really hurt. But again, I have to respect what individual countries do in interest of protecting their citizens. I think the first responsibility of every nation is to protect their citizens. Whether those measures are actually effective or not, I think as countries try to do that. Clearly, as I said in the introductory remarks, the South African leadership must be recognized and appreciated for the transparency, the timeliness of sharing this information. If everyone around the world was doing that, we would be at a very good place. I mean, a very, very good place. I think we need to give our hats to the government of South Africa. We also need to recognize the researchers in South Africa, Professor Tullius group, and we have been working, as you know, in a network with them as part of the African CDC's Pathogen Genomic Institute. So I think that the reaction there, what we need to do going forward is to have a coordinated approach for these variants, to managing the variants, because we know that there will be another variant, I mean, for sure. We also know that we will deal with this variant for sure. And there's a lot we don't know yet about the variant, and there's no need to panic. We just need to be patient and understand the variant and know that we are not helpless. I think today report, we are flooded with many more tools on the battlefield against this virus as a whole. It's still the same COVID. So, I mean, the same public health measures that we have been using for the last 2 years, especially in Africa, applies to this variant. We have vaccines out there, and that is a nice segue to the discussion, your second question about vaccines. Vaccines are beginning to flow on the continent in a very predictable and steady manner. We are all, like you, very concerned that countries are not picking up those vaccines. The uptake is not as we would have loved to see. We are on the drawing board, putting our heads together to see what can be done to galvanize that uptake. In the coming weeks, we will be summoning a meeting of all ministers of health so that we can come together, put our heads and minds and souls together and see what we can do to increase that uptake. So we are not indifferent to the situation. We see this as something that must be dealt with. I mean, I must say that we have to treat vaccinations in Africa as programs. Now, the acute phase of this pandemic is over, in my view. We have to look at vaccines as a program and then develop the right partnerships across the board so that, and use the whole of society and whole of government to try to roll out these vaccines across the board. We truly don't have a choice. We have to use those vaccines there. So in the coming weeks, we will do our part by using our convening ability to bring all ministers together and discuss and find a pathway. We'll also, at that meeting, be building more partnerships across the board so that we have a consolidated strategic approach on how to increase vaccination. With respect to Nigeria, it is very normal that the Nigeria CDC should be sequencing and sharing the information. And I think the work is just is huge out there to sequence the viruses there. So I believe Nigeria CDC will definitely be able to do some of the sequencing, but other centers like the center that Professor Christian Happy runs and others should be able to work in a network to support the work of Nigeria CDC, with Nigeria CDC doing its own part of the sequencing. So I don't know if this is a question that you asked with respect to Nigeria CDC.
No, the question is, if you look at the report from Nigeria, even though the news is there that Nigeria has reported Omicron, if you look at the GSAID genomic database, the sequence is not still available. And this is not consistent with how things were before with previous report from Nigeria, where the report is actually connected with the release of the sequencing. So I wanted to know whether is the conversion of the NCDC into this capability has actually limited the quality of genomic surveillance in the country, or from the perspective of the Africa CDC, looking at the way sequences have been coming out of Nigeria, is the pattern improving, or has this really been reduced to what used to be before?
So I think from, as you rightly said, I mean, the perspective of Africa CDC, and which countries organize differently, and I truly don't know how the internal structures within Nigeria are set up. But I would think that sequencing and releasing those sequences should be the natural functions of the Nigeria CDC, just as the US CDC, China CDC, and other CDCs of the world do. I mean, Africa CDC doesn't yet have laboratories, but in future, when they have laboratories, it is expected that the Africa CDC will be the custodian of those sequences across the continent and will share them appropriately there. So I think I'll leave that up to the internal mechanics within Nigeria, which I'm not really privileged to.
All right, thank you very much. Let's move on to take a question that's come through online. We have inquiries from both Coletta and Vinicius, who are asking a question that you've responded to, unless you have any additional comments, and that is about the message to countries that are banning travel from some African countries. But as I say, you've touched on that already, but Coletta goes on to then ask, with the advent of the Omicron variant and the developed countries rushing to use booster shots, where does that leave us as a continent? And on this continent, she states that we have not yet achieved herd immunity.
I think, that's a very good question. As I said earlier, our vaccine situation is improving. That is, you continue to get regular supplies of vaccines across the continent now. We are not in a situation where we were 3 months ago. And I hope that by December ending and January, you even see more. So, which means the vaccine production pipeline is improving as well. And it doesn't need to be a zero-sum game where countries do boosters and then Africa doesn't have vaccines. So I think the production capacity is ramping up in the Western countries. Donations are also increasing from the countries that have the vaccines. The United States has made some significant donations. You just heard the announcement from, I think, the Chinese. But let me just focus on what has been donated. Okay, yeah, that is going on the continent together with what Harvard is producing, is supplying. As I said earlier, Harvard has shipped out about 22 million doses of vaccines. If you convert that into the double doses, they represent 44 million doses of vaccines. So I think we are making progress there. The thing is that boosters, the question of boosters should be guided by science, by good science. So if you ask my views on the boosters, I'll say that in Africa, those people that are above 60 or so should be getting their boosters, because we clearly see that depending on the vaccine type, you get a reduction in the immune neutralizing antibodies after 6 months. And that correlates also to the severity of the disease. Those with underlying diseases, especially the immunocompromised individuals, should be having their boosters. But that is where I'll limit it. I would not recommend general boostering of younger people yet on the continent. But again, we'll see what the data says next year. So I think it's work in progress. We will continue to observe the science and use the science to drive the booster issue. But the key thing, which I count on all of us to do, is encourage countries, use your respective influences to enable our citizens to go out there and get their shots, because the vaccines are there. Countries are actually, some countries are actually delaying the delivery of their vaccines, including the deliveries from Harvard. So which tells me that the uptake is not as good as it should be. So we cannot blame it entirely on boosters. We should also be looking internally to say, what can we do to improve our own uptake of the vaccines?
All right, thank you. Let's now say hello to Sophie Mukwena, calling from the SABC in South Africa. Good morning, Sophie. Or good afternoon.
Good morning. Good morning. I just want to find out, in terms of the figures that Dr. John Kengasong spoke about on rising cases, when you look at the death toll or fatalities,
Sorry, Sophie, your microphone was muted for a while. Can you just start again from the beginning?
The first question is, when you look at the number of cases, yes, we see an increase, particularly in South Africa and generally on the continent. But when you look at the death toll, there's a decrease. What could be the reason? Does it mean that this new variant might not be, or it is not as deadly as your Delta and your Beta? And we know that Delta is still the main variant that is in circulation around the world. And then the last question, the variant. I think for many people right now, the question is, how effective are the vaccines? Have you received some preliminary information in terms of the behavior of this new variant against the vaccines that we have now? Thank you.
Thank you so much, Sophie. There's very little we can make any conclusions for now with respect to the severity or the mortality related to the new variant. So epidemiologically, you first of all see the increase in number of cases, and then you begin to see the deaths follow, right? Because people don't just get infected and then they die. You get infected, then you may be sick for, you get infected, you start with asymptomatic phases, you get to their symptoms, the severity of the symptoms, then you might recover or you die. So it takes time before you begin to see death rates catch up with the new cases. I mean, that is just typical of what you call the natural cause of an infection. So it is only in the course of the next 2 weeks or 3 weeks that we'll begin to see the number of deaths go up, if they do go up. If we go by what we have seen so far, just what we call anecdotal cases, the doctors in South Africa that described this initially saw patients that were coming down with very mild symptoms, itchy throats, not necessarily a cough, fatigue, mild symptoms. They didn't even hospitalize them. And they look around the South Africa, it was a very similar picture they were seeing. The case that was reported recently in just yesterday in I believe this was in California, from someone traveling from South Africa, had very mild symptoms and had been vaccinated as well. So it was a breakthrough infection. It's not unusual to have a breakthrough infection. I mean, we see that all the time, even with the even with the Delta strain and and other variants there. So we just don't know much about the clinical picture of that, but early signs from South Africa, these are what we call case studies from South Africa reported, refer to mild symptoms, but we'll see in the next 2 weeks. So that is one. The second question is, would the vaccines be effective against these variants? For sure, as a virologist, I can say that the vaccines will be effective. The question would be, what is the level of effectiveness? And that would you be having a 100% effectiveness, or you have a decrease in effectiveness? Remember, these antibodies are they are very robust. They do many things for us. I mean, so in other words, they can blunt these variants, but we just don't know how effective, how level, how high they will be, for sure. We also remember that it is not just the antibodies that are protecting us. There's what you call the memory T cells. Okay, there are two arms of your immune system. One is your B cells that produce these antibodies, the so-called neutralizing antibodies, that normally decrease with time because you are not seeing the virus all the time in your immune system. But then there's the T cells, which is, they are the killers of those infected cells in your body. Infected cells with the virus, they just don't fit. They remain there for us for a very long time. So in as much as we should be concerned with these variants, we will just need to wait for two things to happen in the coming weeks. And perhaps in the next week, at the end of next week or the week after, the answers will begin to be clear. So two things will happen. The researchers will take blood samples from people that have been vaccinated with all kind of vaccines, all the vaccines that we have. They'll put that in the test tube, take the virus that they will grow, or they'll create an artificial virus, mix it with these blood samples, and see whether the blood samples from those individuals that have been vaccinated will neutralize the virus. That is the beginning of the understanding of that, because effectiveness studies, which is looking at the populations, how effective the vaccine is in the population, will take time. So the first thing we usually would do in the laboratory is to do what I just described. So that would teach us whether the vaccines are effective or not. And the answers can be made available in the next week or two. The second thing that will happen is that blood samples that have been taken from people that have been naturally infected but not vaccinated will do the same. They will take that blood, because blood has been collected across the world and stored in laboratories, and they will take that blood, mix it with the virus, and see how the virus behaves in that scenario. So those two experiments, we hope that the results will be available in the next week or the next 2 weeks, and that will give us an idea of whether the current vaccines will be effective or not.
All right, thank you. I'm going to take another call, and please excuse me, I'm going to just be looking away for a while because I'm using a separate device to access the questions. So this one is coming from Ayanat Mercy, who is with Reuters. So she was also asking about how sick the new variant makes people. But then she goes on to say, how does this new variant affect those with comorbidities? And does it affect children differently? Then she has another question where she says, how many countries are able to sequence the variant's viral genome and identify it? Or are all countries using the Thermo Fisher testing kit?
Yeah, so for the first part of the question, the clinical spectrum of that is what I said, we don't know for now. That will require that, and a lot of those answers will need to come from South Africa because of the large number of cases that are there. And this is what will happen. Each time a new case is admitted in the hospital, they'll look at the clinical picture and then compare the clinical symptoms to the existing spectrum of symptoms that we know. So that is what doctors will do. But again, it is a question of time before we know that. And it's also a question of time before we know if the new variant will be affecting children or not. We just don't know. Not infecting them, but whether it will cause disease in them, because clearly children are vulnerable as well. So we just have to be patient and know that we are not totally helpless. We have the public health measures do apply to everything. You cover your nose, you wash your hands, social distance, open windows in an enclosed location. They all work against all variants. They go out, get their vaccine. They work against variants. And I've said they may not be 80% effective, the vaccines, but it will not be 0% effective. And anything that you have on your body is better than having nothing against this until we know more about this variant. So I think that is what we know in terms of the clinical spectrum. With respect to country sequencing, remember I've said several times on this platform that the Africa CDC Pathogen Genomic Network is spread out across the continent. I think we have supported many countries in establishing their own capacities and capabilities, including extensive trainings. So I think I expect to see that these variants will be picked up across the continent very more readily. And what Nigeria is doing is great. Ghana has also picked that up. And my only appeal to the continent is that we should continue to have a coordinated approach. Picking up a variant in a country doesn't mean that the variant started there. It only means that you have good surveillance systems in place and it must be applauded.
All right, thank you. Good morning or good afternoon to Janice Q. Janice, please just give us your news agency and then ask your question.
Hi, I'm Janice Q from Bloomberg News. Thank you for taking my question. I also have three, so I'll try and be very quick. The first one was, in the last few weeks, you spoke extensively about rolling out rapid speed tests across the continent. And I was wondering how that had been going. I know that you were talking about extending the lull that we were seeing at that stage through rapid testing. And I was just wondering if we'd quite got there before this, announcement was made about the new variants, and whether the rapid tests were in fact helping detect the variant as far as we can see. My next question was very much in line with what somebody asked earlier, but just to take it a little bit further. I know that you said, there's pretty good supply of vaccines across the continent, and Africa CDC is working with other agencies to ensure that there's better uptake. But if we get to a situation where we need updated vaccines, are you concerned at all that wealthy countries will gain rush for supplies of those? Or is there better communication going on between globally to ensure that if we need updated vaccines, it's done more equitably across the world? And again, around issues of further mutations, equitable vaccine distribution has been one of those issues that keeps getting raised in the light of further mutations and the risks around that.
So no, thank you, Janice. I think we at Africa CDC had anticipated that we'll get to this moment, the moment of where you go to the fourth wave, and that's why we're very keen to initiate a huge campaign of testing about 200 million people, rolling out antigen tests. And that process is, we continue to ship antigen tests, but we really want to be more partnership and be more ambitious and try to get to 200 million in the next 6 months. Okay, so, and we remain hopeful that once that is launched, that initiative is launched, we need to do, is the right thing to do as we go from wave to wave and the vaccination situation remains very low. So yes, we continue to ship antigen tests, but we want to ramp that up and bring more partners to get to at least 200 million tests by the next 6 months. It's an ambitious target, but it's something that we try to do. So in the coming weeks, I'm sure that you see us inviting you all with President Cyril Ramaphosa, who is the COVID champion for the Africa Union, to launch that campaign and with other head of states. The antigen tests do work against ovarian. Remember this, the antigen tests are really, they measure something different. They look at proteins, the viral proteins, whereas the PCR, the polymerase chain reaction, is a molecular test. It looks at the genetics and not the proteins. So the antigen tests, I have no doubt that it will continue to be very, very effective. With vaccine updates, why don't we be patient and see if we need to update the vaccines? Because for now, we just don't know, Janice. We just need to wait. In the next few weeks or so, we'll know if there will be need for the update. But even if that happens, I mean, and if you take the messenger RNA, it will be a question of replacing those the insert, the RNA, the messenger RNA that goes into the vaccine production, factoring in what we know. So I think it's not like starting a new vaccine production side. It will be a question of just replacing the genetic material, and science has evolved so much. But again, let me not go ahead of myself, and let's all wait and be patient and see what will happen in the next few days if the vaccines will continue to be effective. The first signals will come from what I just described earlier, what you call in vitro studies, studies of mixing the virus and the blood of infected people or vaccinees.
Thank you very much, John. Let's say hello to Erin Bates. Erin, please introduce yourself and then proceed with your question.
Thank you. This is Erin Bates from Business Day newspaper in South Africa. Dr. Ngengasong, if I may ask, in fact, 3 questions. I initially posed 2, but they're all short. The first is, have you done modeling on the anticipated figures and locations of the outburst you've described late December, early January? Secondly, what role has the African CDC played in talks on preventing travel bans or urging for their lifting, especially in the case of the latest variant? And then finally, the meeting you've described with ministers coming up, which will discuss vaccination uptake and driving that, when do you expect that to take place, if you can give either a date or a window as to when you want to schedule that meeting with ministers, and how many ministers from how many countries would you like to partake? Thank you.
So let me start with the last question, going up, Erin, moving backward. We hope that the week of December 20th is what we are aiming to convene all AU member states, all 55 AU member states. So that is the date and that is the scope of the meeting. With respect to the travel ban, you saw what Africa CDC, we were the first to issue a communique, a statement cautioning that what the effect of travel ban will mean. And I'm sure now the AU, the African Union, has now taken a position, which I'm sure you can read that on the the AU website. So I think that is what Africa CDC was the first to take a stand. Immediately, this variant was described, and you can Google and see what we said. In terms of modeling, we've always resisted to not project models because mostly these models are based on assumptions, and we truly don't have all the assumptions that we need to do this model. If you recall, at the start of this pandemic 2 years ago, there were modeling that showed that within 6 months, 3 million Africans would die. Okay, and here we took an exception to that because we look at the assumptions and we're not very comfortable with those assumptions. And guess where we are today? Today we have 230,000 deaths after 2 years, but the prediction was that within the first 6 months, 3 million would die. So we really are always very skeptical to do modeling because we truly don't have many variables that will enable us to do those modeling. What are those variables? Variables on true rate of testing, true rates of mortality and excess deaths, and true rates of I mean, we now know, as I've explained before, that the current number that we have is a grossly underestimate of people that have been exposed to and infected with COVID-19, right? So we know this now based on serology, which is taking blood from people and testing to know if they have been exposed to or are currently infected with COVID-19. So with all of that, all of those gaps, you always have a tendency of your modeling not to be where you really want it to be. So I think we'll leave the modeling for those who do that for a living, but we will not be doing modeling for that. Rather, our focus is to invest in strategies and campaign strategies that will help us blunt the peak of that, the fourth wave or the fifth wave.
All right, thank you very much. Let's say hello to Dr. Diallo. Dr. Diallo, please give us your news agency and then ask your question. Dr. Diallo, are you online? If not, let's move on to a question that's coming from Oiti Penyang Daniel. And Oiti says, I just want to know what the Africa CDC is doing to accelerate manufacturing of vaccines in Africa instead of depending on donations.
A lot. So I invite you to join us in Kigali next week, Monday, Tuesday, to get an update. If you recall, we hosted a very large meeting of about 40,000 people last April to catalyze the continent and advocate for vaccine manufacturing. I'm very pleased that on Monday and Tuesday, we'll be providing head of state update on where the vaccine manufacturing situation is on the continent. Very, very encouraging. And as you know, Rwanda, Senegal, South Africa, Egypt, Morocco, Ghana, Nigeria have all lined up, and some of them are at very different stages of vaccine production on the continent. So please join us next week, Monday, Tuesday, for a live update on the situation.
All right, thank you. We have another question that's coming in from Vinicius Assis, who says, how many infected people, or rather, how many people have been infected by the Omicron variant in the 4 countries that you mentioned? And also, could you please release the number per country? And out of those who were infected, how many of them had already been vaccinated?
I don't have that information for now. We just, the cases in Nigeria, Ghana are still cases reported, detected, but we just don't know how many more people, because contact tracing is still going on until, I mean, you have to give it time. Hopefully by the end of next week, you begin to see the numbers. But for now, it is just a case. So somebody is diagnosed, and then they sequence it, they pick it up, and after that, the contact tracing will start to to see who in their contacts have been infected or affected. South Africa, of course, is more advanced in this, but we still don't have the numbers yet. What I mean is that South Africa will need to look at the new cases, and when anyone comes down with COVID and they will sequence it to see if that person is coming down with a COVID due to the Omicron or the Delta variant. So you see, it will take some time before we unpack that and give you all those answers.
All right, thanks. Judith Akolo, writing from the Kenya Broadcasting Corporation in Nairobi, says she wants a clarification on what you meant when you said the acute part of the pandemic is over.
So Judith, that's a very good question. There's what we have, the acute phase, meaning the reaction. We are reacting to something, okay? That is, we have to admit that it will take time for us to fight this pandemic. If you look at our vaccination rate, we are at 7% today. How do we get to 70%? So we need to really step back and say, how are we going to fight this pandemic in 2022? So let me just step back, Judy. This is a very, very important question, and with your indulgence, I would like to explain a little bit more. In 2020, the only tools that we have in our hands were the public health measures, right? Wash your hands, cover your nose, social distance, places were shut. That's all we had because we had no vaccines and no treatment. In 2021, the situation evolved where vaccines were made available. We were surprised by the speed at which vaccines were made. So we now had two tools. We had the public health measures that we used in 2020, and then the vaccines. The vaccines were not fully accessible in Africa and developing countries, but most developed countries had an option where they use a combination of vaccines and public health measures. We are now beginning to have the vaccines available in Africa, so we also have those options available. In 2022, you have three things going on. Drugs that will be available. We are working very hard behind the scene to work with Pfizer so that Paxlovid, which is the new drug that have shown an 89% effectiveness, will be available. So you have three things going for you in 2022. The drugs, which require testing. You test people, you treat. And then secondly, the vaccines. And then thirdly, the public health measures. So that's what I mean by the acute phase, that we're reacting to something is over. I mean, we have to look at a program and say, with these three tools, there is massive testing, rollout of vaccines, and potentially the treatment. What do we do? What kind of programs do we design to carry that forward? That's what I mean by the acute phase is over. We have to look at more the chronic phase of this disease. I don't think any disease that you're dealing with for 3 years, so next year will be the third year, can be described as an acute phase of it. I mean, the acute phase is usually within the first 6 months to 1 year, and that is over. Remember 100 years ago, the Spanish flu, the pandemic, that happened. Within 1 year, 6 months, it was over, okay? And it had killed, 50 million people, and it was over. Here we are moving into a third year. It means we are slowly getting into, we are out of that acute phase, and we have to look at this as a program, as a disease that we need to fight it for the long haul. That's what I mean, Judith.
All right, thank you. Let's take a question from Adis Getachew, and Adis is with Anadolu News Agency. And he says, is there a scientific basis or technique by which we can gaze ahead into the future and get a sense of a timeline as to exactly when COVID-19 pandemic will begin to go away? And he goes on to say, you said that there would be another variant in the future. Could we predict how many more variants as well as their potency?
I wish we could do that, and I'll be very pleased. As I said, I'm a virologist, and it's very difficult to predict how these variants will emerge. But what for sure you know is that as the virus continues to replicate and circulate, it will mutate. So especially in those with immunocompromised immune systems, that virus will struggle, or the individual will struggle to clear the virus. And the more that struggle continues, the more the virus wins and then mutates and then produce a new variant. So that much we know that it will be the case. I say this from my experience with HIV. We started with HIV with a few subtypes, And by just a few years down the road, there were many subtypes of HIV. So you continue to see this RNA virus mutate and produce more, especially where and if the virus continues to circulate. I mean, it's a recipe for new variants to emerge. But whether the variants will be more dangerous than the current one, we just don't know. It's difficult to predict. So the Omicron situation will teach us, because of the excessive number of mutations that are out there and at the critical sites that the mutations are occurring, it will teach us a lot as to what the future holds for us.
All right, thank you. I think we'll take our last question for today. And let's say hello to Sarah Jerving, who is online. Sarah, please go ahead with your question, and you're with DevEx.
Thanks so much. Can you please talk about the significance of Aspen licensing as opposed to contracting the vaccine? And then secondly, will we receive login information for the Monday, Tuesday conference on manufacturing? Is that kind of open to the media?
It is open to the media, and we will send that link. Our communication team is on this call. They will definitely share that link with everybody. And the difference between contracting and licensing is that, I mean, you begin to have, I mean, the best way to describe it is what you have in with the Serum Institute in India. The Serum Institute in India has a license from AstraZeneca to produce the vaccines, and that's why you call them the COVID sheet, right? So that is a license that they have. It's not a contract. If they had a contract, they would just produce the same vaccines like the ones that they have in the UK. So the vaccines that the Aspen will produce now, they can actually give it a name. It could be Johnson & Johnson Africa, or I'm making up, or AfriVax would be, they can brand it. I mean, that is the difference. It's a very different thing from what they were doing before, which was exactly what Johnson & Johnson just said to them. You have a contract to use your supply lines to produce the vaccine. So that is, I mean, which means that the Aspen Group is really the equivalent of the equivalent of the Serum Institute in India for this particular vaccine in Africa.
All right, thank you. Before we go on to your last comments, let me just read out an announcement that has come from our communications team behind the scenes. And Neke has sent this announcement, and he says it's a special announcement that there will be a special press briefing on Monday, the 6th of December, after the opening ceremony of that important conference in Kigali. And journalists can register, and he has sent the registration link, so you can look it up in your chat box and get that registration link so that you can take part in that conference. Alternatively, he says that you can confirm your participation by sending an email to divine@rwandaevents.com. And that is divine@rwandaevents.com. So it's time now for you, Dr. John, to give us your final summary points from the briefing today.
No, thank you. So I think my first point is related to the topic we are dealing with this week, which is the Omicron virus. I mean, my message to the continent would be, there's absolutely no need to panic. You've heard me insist during this press conference that we have the tools available to fight. Public health measures are effective against all variants. This is not a new virus, it is a variant. So we have all the tools that we've been using for the past two years. Second is, in order to fight this virus, is to mobilize the population, and we get out there and get vaccinated. If you get yourself vaccinated, it is already a step forward in preventing from falling sick due to this variant. So I think vaccination is so important as a measure. And last message, Wayne, is that as we move towards the holiday season, I would ask that really appeal that people celebrate with safety in mind. Celebrate with safety in mind. If the entire family is vaccinated, it is okay to go in there and celebrate without masks. But if you are receiving strangers, even indoor, put on your mask so that we can avoid the spread of this variant, which we still don't know a lot about it. Anyone who knocks at your door and comes in is and who is not vaccinated is a threat to even you who has been vaccinated. So again, let's take vaccination if we want to celebrate happily and in a more relaxed and peaceful mode. Let's go out and get our people vaccinated. So I thank you, as always, for attending this very important press briefing.
Thank you so much. That was Dr. John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention. One last announcement from our communications team is that notice is also available on the WhatsApp group. For those who are on that group, please just go and check it out so that you can get the link directly from there. But for now, it's time for us to close our briefing for today. And let's meet again on Monday and again on Thursday next week. Bye-bye for now.
Thank you. Bye-bye.